Here we presented a post-hoc analysis of the IMvigor130 in which we assessed two testing to see how many patients are expressing PD-L1 according to the SP142 staining, the VENTANA test, and the 22C3 Dako testing. We observed differences in the amount of patients that we are calling PD-L1 positive. If we are using SP142, 25% of the patients were positive for PD-L1. However, if we were using 22C3 test, 35% of the patients, there were 10% of difference in the amount of patients that are called PD-L1 positive, depending on the immunohistochemistry test you are using. Does this difference translate into different outcomes for survival? And we observed that SP142 was predictive for the prognosis of the patients and also for the activity of atezolizumab and chemo. That was interesting to see that those patients labeled, named, called PD-L1 positive according to SP142, they have better chances to respond, to live longer, for both, for atezo and for chemo, versus if they were positive just for 22C3. Interestingly, those patients who were positive for 22C3 but negative in the SP142 staining, they had the worst prognosis no matter if they were treated with atezo or with chemotherapy, probably translating a different biology. The conclusion is that probably dendritic cells expressing PD-L1 are key in selecting patients for immunotherapy in this field and are key to predict for the prognosis in metastatic urothelial carcinoma.